all I do is sleep and rest and take my medicine, and I think home is the best place for you.
This is Mildred Carter. She was told 2 years ago that she was dying, that there was nothing more the doctors could do. She decided last night that she wanted to stop treatments and go home. With advances in medicine, a whole new problem of when to keep people alive and when to stop treatment has arisen. But dying has always been a difficult subject to think about, to talk about. At what point is the medical profession no longer prolonging life, but prolonging death? Sister Rosalie Mallard, who is Director of Pastoral Care at St. Joseph's Hospital, faces that question daily. It's her function to make dying easier for the terminally ill patients at the hospital and to counsel them about the choices that are available to them, medical and religious choices.
We feel that there is an obligation to use whatever medicines or treatments or operations that offer reasonable hope of recovery can be obtained without excessive pain, expense, or other hardship. However, if a person is terminally ill, then we feel that there is a point at which the patient, in conjunction with the doctor, may come to the decision that it's no longer necessary to use these means, so that I would help them to sort out the reasons why they want to discontinue treatment, why they feel that treatment would no longer be of help to them, and support them in making a right decision, what we would consider a right decision.
This whole problem was highlighted last week by the death of Dr. Fred Crawford at Emory University. He took his own life after suffering for 2 years with prostate cancer. Dr. Jack Boozer was a close friend and colleague of his. He is a professor of theology at Emory.
People are groping for a different term, away from euthanasia and away from suicide, to allow the possibility not of a person dying in an arrogant court of bragging death, be not proud, and not in just a submission, well, this must be the will of God for me to live through all of this pain and all this suffering and all this meaninglessness. But as my life is finished, the meaning of my life is fulfilled. So I can die in peace and hope, and I can die in some courage without having just to wait for the thing to peter out in pain or meaninglessness.
Back to Mildred Carter. She wanted to talk to us. She didn't want to die in the hospital. She didn't want to take any further tests. She felt she could continue treatment just as well at home.
I hear you're getting ready to go home.
Yes, I'm waiting for an ambulance now.
Mm-hmm.
Take me home.
Mm-hmm.
I think I'll be happier, more comfortable, and, well, I've had such a bad time. I think I'll just be better off at home.
Yes.
Yeah.
And I hope the time with your family is going to be a good time.
Oh, I have my church, and I have my friends and family, neighbors. So I have a lot of encouragement.
And so today, Mrs. Carter went home to her husband in Doraville. On the way out, she told the nurses at St. Joseph's that she would probably see them next year. She just may.